Hi, and welcome to our weekly podcast. This week I have with me Tara Mund. Tara is a physical therapist here at Alpine Physical Therapy, and we're here to talk about the physical therapist approach to incontinence. Tara, we're glad you're here.
Thank you.
Tara, I just wondered, you finished your doctoral program in physical therapy about a year or so ago, and I'm just wondering, in most doctoral programs, are there opportunities for learning about health issues such as incontinence?
Yes, we're educated on a full semester course in terms of women's health based issues, including incontinence and pregnancy, postpartum, that type of thing.
And I just wonder if somebody's really got an interest in that, they're probably going to want to go on and get additional education.
Yeah, the continued education definitely helps to broaden the education that we're given at school. I've taken a few extra courses in addition to that to, gain knowledge and some extra experience in this area. So.
Well, I certainly appreciate the fact you've gone on for that education. I know some of our viewing audience will appreciate that as well as they begin to learn about this topic and kind of come out of the closet in some cases. Because I know it's a touchy subject. Sometimes, it's a little bit embarrassing maybe to talk about this topic. How do you address that issue?
Well, I just encourage people to say something because it's so common among people. I mean, more than 13 million Americans are dealing with incontinence, and it's embarrassing. People don't want to mention it, but if you don't mention it to your doctor or to your therapist, we can't help. And there are things that we can do and work on to really improve your quality of life. And so I just would encourage people to confide in your healthcare providers.
So that's a really good starting point, is just acknowledge it and begin to get some help. That's great. I just wonder, in terms of how you define the various types of incontinence. I've heard of various types. Can you help our listening and watching audiences to how these things are defined?
Sure. There's a number of different categories. Stress incontinence is very common, which is an incontinence that comes about when you're doing some type of physical activity and experience some leaking, some jumping, lifting, something like that. I have a lot of moms come and tell me after childbirth, I can't jump on the trampoline with my kids anymore. That would be a classic example of stress urinary incontinence, and basically that's caused just by some weak musculature not being able to hold the bladder neck up to keep the volume of urine held within the bladder. And then we have urge incontinence, which is characterized by a strong need or urge to urinate without time to get there. When that happens, it's immediate. I have to go to the bathroom. Once you realize it, it's too late, and you often would experience a larger volume of urine loss. Urge incontinence also has, typically will have triggers that will set it off, such as like hearing water running and then realizing that you have to go to the bathroom, or putting your key into the front door when you get home and you're not able to make it through the door. Urge and stress incontinence can often be combined together. It might start off as stress incontinence and then develop into like more of a mixed urge and stress incontinence. There's also, neurological causes of incontinence, can be from multiple sclerosis, Parkinson's, diabetes, peripheral neuropathies, that type of thing, where you're having overflow some of the time, where the bladder's always full and it's just overflowing that way. Functional incontinence for those folks that just, have completely normal functioning bladders, but they're not able physically to get up and get to the toilet. So that's a different population of people that you're dealing with there.
Yeah, it's good to know the different definitions. We hear a little bit about it, but now it's nice to be able to at least categorize those. Now, what about people in terms of groups of people? You've mentioned the neurological potential for problems. Are there other populations of people that might experience incontinence?
Well, typically, the first time that a lot of women especially, would experience some type of incontinence would be during or after pregnancy. The extra weight put on the pelvic floor causes problems for a lot of women. Then again, like during or after menopause, that's another big one there. Men that are dealing with some type of prostate difficulties frequently will have some type of incontinence associated. You know, even as young as children, bedwetting, you know, that can be a difficult time that kids can be dealing with it. Nighttime wetting, that type of thing. So, you know, there's not really a rule in terms of, you know, it's not just an age thing. People can experience it at all ages. And then surgery, you know, there's surgical trauma, that type of thing that can also bring those symptoms on. So
it's a wide variety. Tell me, if someone were watching and they were wanting to get more information or learn about what a physical therapist, how that physical therapist might approach their condition, how could you address that?
Well, you know, that would depend upon the specific type of incontinence and the origin of that person's dysfunction. I think that for stress incontinence, like I said, that's a weak musculature. So we're going to be working on building back up that pelvic floor strength, being able to maintain the position of the bladder. Kegels is a very commonly prescribed exercise for incontinence, and a lot of people are familiar with that. I think that combining Kegels with deep abdominal strengthening, core strengthening is really important, because I'll get a lot of patients that incontinence will go right along with low back pain. Those two will come together. And in fact, that's how I often find people, you know, telling me they have some kind of type of incontinence symptoms. They'll come to me for low back pain, and I'll treat them for low back pain. At the end, they'll just kind of mention, well, you know, my incontinence has gotten better. And they didn't even tell me at the beginning because they were embarrassed. But
well, there sure is a lot of science on that, about the correlation between one and the other. So that's a great point.
So using, you know, typical core strengthening exercises, Pilates is really great. And then there's also another approach that was developed by Janet Hume, and that's called rolled for control. And that's using non-Kegel-based exercises along with some autonomic nervous system balancing, which can be problematic in those folks with urge incontinence, as well as diet and lifestyle changes. You know, different foods and drinks that we eat can be very irritating to the bladder and can cause the bladder to be hyperactive and contract when we don't want it contracting, because that's going to cause the voiding. And, you know, making simple changes like cutting out those foods that are high on the bladder irritant list can make a big difference.
Wow, so there are a lot of things that particularly someone like you that's got the extra education can actually help folks with.
Definitely.
Well, I'd like to say thanks, Tara, for being with us and sharing with us some great information. And right now, we'll go to the tip of the day.
For the tip of the day. Kegels are a very commonly prescribed exercise for incontinence. However, I often see patients performing them incorrectly. Rather than drawing up and in, I often see people bearing down or pushing out, which could be causing more harm than good. If you're unsure of whether or not you're doing Kegels correctly, stop doing them. Consider consulting a physical therapist to have them instruct you on the proper form and make sure you're doing your exercises correctly.
I'd like to thank again Tara for being with us and sharing this excellent information. If you'd like more information, be sure to visit our website, and you can contact Tara at our North Clinic at 541-2606.